This episode of A Conversation with John Conenna is sponsored by Generate. In today's digital age, staying ahead means harnessing the power of generative AI. Wondering how your small or medium-sized business can join this revolution? Look no further than Generate, your strategic partner for integrating cutting-edge generative AI solutions. We create personalized plans, adapting existing AI technologies to fit your specific business needs. Plus, our expert team provides essential training, empowering you to make the most of these innovative technologies. Interested in transforming your business with AI? Reach out to us at generateteam@gmail.com. That's generate, GENERAIT, team@gmail.com. And now, on with the episode.
Good evening and welcome to another edition of A Conversation Tonight with John Conenna. This is truly an honor for me tonight because I bring in a gentleman. His name is Dr. Parag Doshi, who is a nationally recognized leader in the field of complex coronary and peripheral vascular intervention since 1998, and also Dr. Parag Doshi is the founding director of Chicago Cardiology Institute. It brings me great pleasure to bring this gentleman in because in 2009, I had an episode, and this gentleman basically saved me and changed my life and in the way I'm thinking, in the way of health and everything else. Tonight, we will talk about cardiology, heart rhythm, vascular, valve clinic, and a problem that I had in 2009 and still continue to have, but with his help, I have lived a normal life. Atrial fibrillation. Good evening, Dr. Doshi, and welcome to this, and truly honored, like I said, to bring you in. How are you doing, young man?
I'm doing good, and thank you for giving me the opportunity to converse with you and reach few people who may benefit from our conversation.
Yes, definitely. This is going to be something that I always have looked forward to, and I know you're a very hard person to pin down, but for a good reason. You're always treating the lives of others. How does this start for you in the sense of how you got to this level of being what I feel you are, a specialist, being one of the leading doctors of the world?
It's very interesting. When I was in medical school, after finishing the school, I had 6 months before I came to the United States, and I served in an intensive care unit where we took care of a lot of patients with heart attack. And I was involved in their immediate care as well as a recovery period. And from that point on, I had the mission that I like to be a cardiologist. I came here, I pursued training, both in residency fellowship and then also did the research and chose the field of cardiology. And I love being a cardiologist because we get to do a lot of fancy procedures, right? Stents and angioplasty units, some of the most complex life-saving procedures. But unlike surgeons, we get involved with that patient, both in preventive aspects, as well as changing their life and to continue. So we get the advantage of being like a surgeon, doing procedures, make immediate change, but then continue on to our patients who become part of our extended family and friends. And that was what really attracted me to cardiology to start with.
I see this in your everyday practice. What schooling, if you don't mind telling our audience tonight, you studied a course in India, correct? What was the name of the school? It was a very famous medical school. I think it started with a B.
Right. So I went to medical school the school's name was Baroda Medical School. And it's a part of AMS University, a very well-known school founded in the British era. And then I came over here and did my residency under Christ Hospital and Rush University program, continuing to fellowship. And then I also pursued research for a while. And then I went to Indiana Heart Institute to pursue additional training.
Yes, and
Which was at a stage there where I had nothing else to do and I had to start practice. So
right. And I'm glad you brought up that was at Indiana University, correct?
Indiana Heart Institute.
Artist. And matter of fact, I will ask you a question later on about that as we move forward in this interview about a famous Thomas Lindmayer.
Oh my goodness!
Yeah,
You are right.
that you mentioned, and you have esteemed him. When was so your main thing, of course, being the cardiology? This becomes the day to day for you as you become with this every day with the clients and other doctors and everything else, correct?
That is correct.
Yeah.
I practice cardiology. Now, having said that, being a cardiologist does not mean that you shut your eyes to other organs and other diseases. Heart is the center of all. So we pay attention to every single organ and every single disease in the body
Right.
while we're practicing the cardiology, which is a heart disease management.
Sure. The cardiology is, of course, is influenced by this, how we live, our lifestyle, our environment, things beyond the control. And of course, the heart rhythm is the comprehensive care for the patient. So these 5 things that I've opened up with tonight, like you are saying now, all have this tie in together, right? You see this with every different type of patient.
Exactly right. And in the way I look at heart and vascular disease is wherever the blood flows in your body is something we have to pay attention to.
Yes.
And indirectly, even other diseases, whether it's a disease of kidney or whether it's a disease of your lungs, they all indirectly or directly tie into the heart and vascular disease.
I see. So everything we do, and I'm going to use something that my father used to say to me, and I'll tie it in with you, Dr. Doshi, is everything we do, and especially with our bodies, becomes a consequence, correct?
That is exactly right. And unfortunately, we are experiencing a massive epidemic of obesity. We also, in the United States, as well as in other developed countries, we have changed our lifestyle. We've become more sedentary. Our diet has become more processed food. The children are getting exposed right from their school age to unhealthy diet. And all that has led to explosion of heart disease. In addition to that, now if you think about it, we have improving healthcare. So even with more disease, more obesity, more diabetes, people are to some extent living longer, but they do carry the burden of disease. So the attention must be paid from the childhood. And our focus should be on preventing the disease, control the lifestyle, maybe add some exercise in your day-to-day routine, change the diet, change the stress level. And in case, if you are unfortunate enough to have the heart disease, it's not too late. You can still make the difference.
Sure, sure. When I first came to see you in 2009, I remember you saying, John, there are things that you have to change. You cannot keep up a lifestyle that I was keeping up at that time, which at that time was a little bit of a stressful lifestyle, which we'll get into later into this. But this again affects the valve in the heart rhythm, the vascular, and of course, the situation that I had, the atrial fibrillation. Again, you brought up the thing about processed foods, how we eat, the drinker, the smoker. All these things have different effects on different people. Do you see this as you never really see the absolute clean person, but you do see the person that is progressing in the right direction once they see you and once you make the remedies for them, correct?
Exactly. So my focus is not just putting a stent or giving a medication and telling the patient to go home. I always try to make them change the lifestyle. My patients are always encouraged to whether change their diet, add some exercise, maybe reduce stress, And then also take the medications and not fall for a lot of pseudoscience, or I call them Google doctors. I don't go and Google stuff and start being a doctor.
Right, right. And thank you for bringing it up that way, because sometimes I'll tell people, well, I did this and I did that. Well, I Googled it and this is what you have. No, I'm going to go to a professional like a Dr. Parag Doshi to find out what I have, because what you have and what I may have could be two different things. I want to back up a little bit, Dr. Doshi. When did you realize that? Okay, because here you have been very innovative with of course, you're the founder of the Chicago Vascular, the Chicago Cardiology, to bring that up. When do you find the passion, no less the time here? Because you are very regimented, and I've never seen a doctor with a work ethic style that you have. When do you find this passion to say, okay, I'm going to do this now. I have this under my belt and I'm going to move forward. When was that year, that time?
Uh, if you want to put the precise finger on it, I think it would be in my third year of medical school. And I'll actually give you the backstory.
Yes, please.
I never wanted to be a doctor.
Oh, wow.
So I was growing up in India and then back in 83, which was the last year of school. In those days, in the medical school admission, all the engineering colleges, which were the other prestigious, the specialty, it was strictly decided on your final exam scores. And in those days, computer and electronics engineering was quite new. And in my state, there were only 30 seats. I happened to be in the top 15 students in the state. So I could have walked in either engineering or medicine. And we were supposed to fill out two forms, one for engineering match and one for medicine match. My late father, bless his heart, he wanted me to be a doctor.
Yes.
So he was supposed to bring the forms for both these specialties. One was engineering side and the other is medicine. And the day before deadline, he was going to pick up the forms I was in a smaller town, and then he was going to take them back to the city to, get me registered for both this line.
Sure.
He simply did not bring the engineering form. He claimed at the time that he forgot, and then he later admitted. So I never got a chance to be an engineer.
Yeah, he's right.
So my first 2 years of medicine, I did not have the passion. And then about 2.5 years into medical school, when we are exposed to patients, and I had my clinical ward exams where we actually have to examine the patients and take the history. One of my close friends, who's now a urologist, he took me to the wards, and then he always wanted to be a doctor. And I saw his passion, and then we had this indigent, poor lady who was pregnant, and we were examining, we were taking history. And I saw the human connection.
Wow.
I felt that that lady, she was talking to us, and it was so obvious that she trusted us. She was about to deliver a baby. And that connection, looking in her eyes, I realized that I think this is a good place to be.
Wow.
I went back, started reading the library, and from third year onwards, I had a lot of catching up. I wasn't studying very hard, and I pretty much studied 14, 15 hours a day for almost next 2 years. And it became apparent that this is a fascinating field of study, that when you take the theory and apply it to a living, breathing human being who's made of billions of cells, and God knows what goes on in the brain that we still have not figured out. Sure. So you take this fascinating science and now apply it to the person in the room. And it became a passion, and I don't think I've compromised ever since.
I have to tell you, because my memory, of course, when I met you in 2009, yes, I felt a connection with you. From not knowing you 6 hours before the episode that I had, to meeting you that day, and now you told me what I had to do. Well, that story you just brought up now, again, reminds me of the story when I met you. To fast forward just a little bit, what is, you think, the biggest downfall that you see with the patient? If it's me or the other patients that might have valve problem, heart rhythm, what do you see? Is it a neglect in how they have lived their life? And now, they've abused something. Maybe if it was the smoker, the drinker, the obesity. What is the main thing that you've seen in this career of yours?
So I think you pointed out quite correctly that our lifestyle in the undeveloped world is a big problem. Well, I will actually take a little different approach. I've done a lot of reading and research, and then I also changed my lifestyle. I was so busy with my career and I didn't exercise and I gained weight. And then I realized that at the end of the day that I have to follow the lifestyle and I have to look after my health. And along the way, we realized that Americans are living an unhealthy lifestyle, but it's not their fault. There are systems at play. You go to the grocery store and there is a bombardment of unhealthy food. Why is it that healthy vegetables, which are a lot cheaper to grow, tend to be more expensive than your hamburger, or tend to be more expensive than some of the simple grains, which are a lot cheaper? So we are victims of changing the dynamics with the food industry. We also have victims now with social media and that instant gratification. And we need those clicks on the Facebook and Instagram. And we need, instead of going to the store and buying healthy vegetables, we are sitting on one of those online places and buying chips. So we have become victims of unregulated pressure from different industries. But at the end of the day, you are in charge of the destiny. You have to fight those forces and help prevent the heart disease for yourself and your family.
And of course, the lifestyle that we all lead, like you had said, even yourself as the professional doctor, you got caught up in this too, meaning in the sense of the lifestyle, your career, everything else. We get caught up that the famous line is, okay, I'll start my diet tomorrow, or I'll start to eat healthy, or we make a resolution that we never keep. And this becomes then a domino effect on the body. I have to ask you a question. From the start of your career to now, have you seen this progression of your patients where really there is a total neglect? Do you see where from when you started and your career, let's say if it was 30 years ago, which is where I think we're right on target here by saying 30 years ago, and of course with all the advancements, do clients think that this is a one-time fix?
Yes and no. I think I've seen both positive and negative.
Yes.
To me, I think our sad state of affairs in terms of food, I propose that it has been pretty much same as, except maybe increase in the sugar intake, and which is also affecting the obesity. But another single debilitating factor is the use of internet and social media and computers. And I think, just think about it. Instead of shopping and then walking that store aisle, or parking your car and walking through your Target or Walmart or whatever the store,
Right.
Now you are sitting on the computer, browsing on your windows, and with one click, you are getting stuff in. We've also become addicted to many social media sites. And I think another factor with the same regard, we have become victims of misinformation. So people are coming up with crazy stories, and statins have saved millions of lives, and people will come in and refuse to take the medical because some on the goofy corner of internet, they found that it's bad. What used to happen before the internet, before we became so addicted to internet, our information came from magazines and newspapers. And it's sure there was some yellow media or some goofy magazines, but overwhelming mainstream news media was responsible, and there was a filter between misinformation and information, right? Now we don't have that. It's all unmitigated. You are getting unfiltered garbage from internet. And to me, that alone has been a huge factor in diminishing the health of the modern countries nowadays.
And I have to say thank you again for saying that, because not only this vehicle becomes a stress factor for us. Like you said, everything is at our fingertips. Everything, we want it now, and in a lot of cases we want it yesterday. But you are right, it leads to just this fast lifestyle that we are not accustomed to. Like I said before, we could read and adjust. People think they can self-medicate themselves. So this is a great point by you. A question I have, of course, the 5 things that I brought up tonight: the cardiology, the heart rhythm, the vascular, the valve, and the arterial fibrillation. Do you see, as the doctor, the vascular doctor, the cardiologist, do you see that high blood pressure now is a big factor amongst the patients and clients in not only in Illinois, but in the world?
It is an incredibly debilitating disease that where both us doctors and the patients, that the regular people, have neglected. 60 to 80% of the people with hypertension or high blood pressure are not treated optimally. Data is very clear. Current guidelines are to keep the blood pressure below 130 or 80, although normal blood pressure is 120 or 80. And even a borderline blood pressure, such as values of 120, 132, 133, they increase the risk of heart attack and stroke by 25 to 30%, and also dying from that. Hypertension is also affected once again by our inactivity and worsening obesity. Obesity, as well as being overweight, directly contributes to hypertension also. And these 2 factors are creating almost a crisis level situation. Billions and billions of our healthcare dollars are spent for the simple to treat and easy to prevent conditions.
Sure. Is obesity, we'll use a little bit of a milder world, is overweight the biggest problem in the blood pressure?
There is no question about it. I mean, lack of exercise also contributes. Our diet and all the processed food, as well as high sodium food that we pick up from the restaurants or supermarkets, they all contribute.
And like the sodium levels, everything else, correct?
Exactly.
How, Dr. Doshi, how does this affect the valve and the vascular also? Now this becomes like a domino for this high blood pressure to affect the other things, the heart, of course, especially, and the valve, and something that I had come across, arterial fibrillation.
So valve disease is not as directly connected to hypertension. It is a form of the commonest valve problem in this country is aortic stenosis, or narrowing of the aortic valve. That's a valve between your pumping chamber, left ventricle, and aorta, which is the water main for the whole body. The next common valve problem in this country of importance is something called mitral regurgitation. Mitral valve is the valve between the priming chamber on the left side, called left atrium, and the main pumping chamber, called left ventricle. Mitral regurgitation is seen in people with a little more frequently with people with hypertension. However, hypertension is a significant risk factor for atrial fibrillation, which is the irregular heart rhythm, where the priming chamber, the left atrium, is sort of beating regularly in a sync with the main pumping chamber, is just simply fluttering. It's not doing any job. So the heart loses about 20% of its ability or reserve capacity, and it increases the risk of blood clot forming within the left atrium. That blood clot, if it breaks loose, can go to the brain and cause a stroke. So that's a true domino effect.
And which leads to that. And again, medicines, of course, because I remember being on the Metropolo, different medicines, blood thinners, and everything else are a help. But again, as you say, your claim here is then exercise, diet, and a simpler lifestyle can bring these things to control while having the proper medicines, correct?
So all the things that you proposed,
Yes.
being lifestyle, avoiding being overweight, and all those lifestyle changes may actually prevent the problems from happening, right? Now, if you do have those problems, you will need medications. But again, those changes would reduce the impact, reduce the severity of the, like you can get hypertension, but if you are exercising, if you change your diet, you can either reduce the amount of medication, or in some cases, you can completely come off the medication. For example, if you are going to treat atrial fibrillation, once again, lifestyle changes in your sleep habits, changes in your diet, reducing weight will make atrial fibrillation more manageable, for example. So at no stage in life, from the time you are born all the way to the 80, 90, or 100-year-old person is closer to passing away, lifestyle matters.
Sure. I have to tell you, which I find amazing in all the years I've known you and come to you as one of your patients, what I find amazing is I could walk into that room and you can have that stethoscope on and you put that stethoscope to my heart after I've had an EKG, anything, and you know if there is something that is just not right. As me, as the patient, I find this amazing on your end. Have you heard some of the craziest things? I will go that route because not being the professional. When you listen through that stethoscope, have you heard crazy things in patients' heart?
So I'll give you a story on that.
Yes,
I think,
please.
whether it's crazy or it's really rewarding story.
Yes.
When we are using our stethoscope and looking for the valve problems, I will admit to it very first that notwithstanding your trust in me, we, current generation of cardiologists, are nowhere close to being as good as the cardiologists from 50 years ago with the stethoscope. Why? Because we have the testing modalities. We have echocardiogram and CT scans. So we have less training, or we have less of years than our predecessors 50, 60 years ago, because they did not have echocardiogram. I mean, the only way you could diagnose a heart valve problem was by stethoscope, and frankly, with the autopsy. So they used to be much better. But I have always found that overwhelming number of problems can be diagnosed. In fact, 70% of the problems can be diagnosed by taking an accurate history and paying attention to patients' complaints. And then additional 10, 15, 20% can be caught by exam. Now, why do I bring up this? So back in 2009, this was the first year I had started Chicago Cardiology Institute. I did not have this army of doctors that we have now. So I was on call and I was examining patients and in the emergency room every single day. One day, it was a 14, 15-hour day at 8, 9 o'clock. I was tired and I was in the emergency room seeing a patient. And as I'm stepping out, the emergency room doctor calls me, "Hey, Dr. Doshi, we have another consult. It doesn't look like patient has gastritis, but patient points to the chest. So the primary doctor asked you to see the patient." And I'm thinking, you know what? I can see the patient tomorrow. And emergency doctor said, "You know what? She's having nausea and vomiting, so we can treat for the acidity and gastritis, and you can see the patient at your leisure." And then I changed my mind. I'm here, the patient is here, I might as well see her. And then, be done with that. I go in the room and the patient looked quite a bit in pain and not right. Patient was pale, and you mentioned that, that sixth sense or feeling. And I just didn't feel that the patient was doing well. I mean, her complaints were nausea, and then she pointed to the area where you would find typical ulcer pain in the middle of the lower chest. And the electrocardiogram was pretty unremarkable. So I had started Chicago Cardiology just 6 or 8 months ago, and I had bought myself a reward, a present, a brand new stethoscope that was high fidelity. So I put the stethoscope on her heart, and then I hear this extremely faint murmur, extra sound that is classically described in people who are having a massive tear in their aorta. Now, I did not feel that I was as good as my predecessors, and I did not feel that I'm really hearing, but I felt that I think everything fits, and I think she has it. And instead of that lady getting antacids and being discharged either in the morning, I thought that she's having a major tear. So the immediate test is you get a CAT scan of the aorta, but that does take about 20 to 30 minutes to arrange. But this is a life-threatening situation. So I called the cardiac surgeon and I told them that I think that this lady is having dissection. And fortunately, the cardiac surgeon, heart surgeon, had the faith in me. He says, Parag, if you are saying that it's dissection, I trust you. I'm going to get my team on the way. And this is even before we got the CAT scan.
Wow.
CAT scan gets done in about 20 minutes, and literally as the surgical team is entering, and she had a massive tear.
Jeez.
He took her to the CAT scan at Alexander Brothers is close to these surgical suites. On the way, her heart had stopped, so they literally had to take her doing CPR. They got the heart open. It was an 8-hour surgery, and she was in the hospital for 4 weeks. And that was back in 2009. And every single anniversary of that operation, that wonderful patient of mine, Rosemary, she's become like my aunt. She's become like my friend. She calls me every single year that, Dr. Doshi, this is the anniversary of the day that you found that.
Wow.
So
I have to ask you the question then. If you don't stay at that hospital that night, does Rosemary live to see tomorrow?
that lady was on her way to cardiac arrest any moment.
Wow.
It was just God was looking over her. I'm
That-
telling you that story just exemplifies how being a simple, good old-fashioned doctor, paying attention to patients' symptoms and
Symptoms.
also examining carefully makes a difference.
And Dr. Doshi, you picked this up with a normal, I mean, a high-end stethoscope, correct?
That is completely correct.
Wow, that is amazing. I want to just stop a little bit here to tell our audience again, we are visiting tonight with Dr. Parag Doshi. He is a nationally recognized leader in the field of complex coronary and peripheral vascular interventions. He is also the founding father of the Chicago Cardiology Institute and is also the founder of the Vascular Clinic. This is just amazing. I truly, truly appreciate you leading to that story because one thing I'm going to say to you at the end is something that I think a lot of people are going to realize, and something in your everyday that you've always told me since matter of fact, when you bring up 2009, it was 2009 when I met you. So myself and Rosemary have something in common, at this time. Well, we could be here for, I know, another 2 hours, but there are 5 things I would like to ask you before I let you go, because I know your time is valuable and I appreciate this tonight immensely. And I'd like to ask you, as we get toward the end of this, who were some of your early mentors in your career that to this day, Dr. Parag Doshi remembers and still has that memory. Those early mentors, are there a few you would like to mention? If it's your parents or any doctors or anything else?
So you hit the point. My earliest mentor, I think the people that I always say that whatever I am is what Warren Buffett calls ovarian lottery. I was fortunate to be born to the parents. Otherwise, I could have been begging on the streets somewhere, right? I mean, but I was born to the parents who instill values. And then my father was a jeweler, and I have seen him treat his customers. And he was one of the most popular people in town. Everyone loved him.
Wow.
And I saw him interact with other people. And I think he's the guy who actually put the bedside manners in me. My mother also, her kindness and humility have taught me a lesson that whatever I am, I'm not a big doctor, John. It's the patients who lift me up. If I forget that, I fall on the ground. So that came from my parents, right?
Right.
I do believe that my faith in my religion, which is founded on nonviolence and helping everyone in the universe, also guides me in my day-to-day practice. Now, when it comes to some of the mentors, Tom Linemeyer that you mentioned, he was my teacher in heart angioplasty and stents. And those days, Indiana Heart Institute was one of the leading places in the world. And we used to get incredible number of fancy devices and technology, but he always kept the patient in the focus. And the amount of teaching, the way I got to see complicated procedures being done, left that indelible mark on my career. And then along the way, every single teacher who has been, I'm not any special. I'm just a product of all the people who have helped me on the way. That's all.
That's fantastic, the way you've given kudos to some of the, I'm going to ask this I was going to ask the third question, which for now becomes my second question. Again, going back to Thomas J. Lindmeyer, who was a leading pioneer in his field out of the Indiana University. Again, those are really memorable moments with him, Dr. Doshi.
Oh my goodness. I mean, the way he taught us, the way he allowed us to flourish in the field of angioplasty. He would allow us to do procedures independently, but never, ever compromise patients' health because of it. And that combination is simply rare. The coronary angioplasties were started by a guy called Andreas Grunzig. Dr. Grunzig is the godfather of our specialty. He figured out how to do this or what to do for people with blockages in 70s in Switzerland. And subsequently, he came to Emory University. My boss was trained by Dr. Grunzig. So you can say that I'm the grandchild of the guy who started the coronary angioplasty.
Well, fantastic.
And it was unbelievable learning from him how to do things efficiently and keep the patient healthy. And always, when a doctor does, whether a surgeon or a cardiologist is doing a procedure, we have to remember that it's not about your ego, it's about the patient. And that's something that I picked up from my training.
That's fantastic, yes. And I see that about you every time. Question I'd always like to ask you, question too. I know that reading and running and photography in your free time, what is your ultimate favorite, so our audience can know, and some of your patients who will be seeing this interview in the coming days, what's one of your favorites? I know three of them, and you're always rubbing in my nose how in good a shape you are and always pushing me to stay in shape. What's one of your favorites?
So I believe that I think reading, pathological level of reading, that incredible desire to constantly learn something new about this world, the universe, is, I think, my number one passion. From the time I was 5 years old, I think I discovered the joy of reading when I was 4 or 5 years old, and both fiction and nonfiction, as well as medical literature. And I have come to believe that the day you do not acquire something new about this world, which is so fascinating, is the beginning of your senile dementia.
Sure.
So you must acquire something new. It may be a one word, one fact. So once again, so reading by far is my passion, and everyone around me knows that.
And and I'll say this toward the end, how you've kind of put that in my mind, because I was a lover of books, but now I've become really a lover of books, and it's in those conversations I had with you. Do you have an all-time favorite book or author, or something that you remember that you could go back to that book and say, God, I want to look at this chapter again or read this chapter again? Because that's something that I do a lot. Is there an all-time book that
So,
describes your passion?
so many books have in different words, right? In both medicine and non-medicine. So I will
Sure.
stay just off the bat, I will come up with two books that have deeply affected me. One is relatively contemporary, William Styron, Sophie's Choice. It was made in a movie also with Meryl Streep. And the movie is fabulous, but the book itself, the horrors and atrocities of Second World War, and the choices, the difficult choices that some people had to make truly. Sophie's choice was that the Nazis put two children in front of the gas chamber and said, you get to choose one of them. And that book is one of my all-time favorites. And then the other book is the autobiography of Gandhi. MK Gandhi fought for the freedom of India, but fought is a misnomer because he only used non-violent methods. He was steadfastly against violence. And he truly was next to God. When he died, Albert Einstein, to some extent, said that the future generations will find it hard to believe that a person like this walked the earth. So his autobiography, which is My Experiments with Truth, is one of the most incredible book, and that is still guides me, and it serves as an inspiration to me.
Fantastic. I'm so glad you brought those up. Two phenomenal books. And of course, I know the story of the Sophie's Choice, but something that I would like to look into myself in regards to Gandhi. Question for you before I do the last question with you. When you see that patient first, and you see how, say, again, if it's the vascular, the atrial fibrillation, the heart rhythm, the valve, and then you see that patient make the turnaround after coming to see you, let's say over a year or 2-year period, that now you've put this person back on the right track. How does that make you feel as this professional specialist doctor that's in my eyes? How does that make you feel when you see that so-and-so, if it's the Rosemary or the John Conenna, now has come back from what you saw him that first day?
So John, when I treat you or my patients, to make a change in your life is a very, very selfish endeavor, because it is you guys, people who have been with me, they become my closest friends and family. So when my patient comes in and then I make a change and they come back, they're feeling better, that joy, it is so infectious. It is the most contagious disease in the world. And that joy is what drives me every single day. Modern life, and being a doctor, it sounds like a cliche, but it's not been easy. So that joy of making a difference is literally and truly from the bottom of my heart, it drives me every single day. That when you pick up the phone and says, Dr. Doshi, I want to call you, or I want to, the way you are talking to me, you respect me. Or my patient, another guy, Bob, Mr. Bob D, who I spent half the night, he was going to not make it after a heart attack. And I spent literally
Sure.
6 hours in the ICU giving medications with every single time. And then he made it. And that was in 2011, I believe. And guess what? In summer, I go biking with him in the forest reserve, and then we share a beer. Now, this is so special. So to me, when I make a difference in your life, it's really about making a difference in my life.
Sure. That's that good feel. It's like, I wish, I'll say it this way. It's a like the good drug, but it's a good drug to have.
Exactly.
Yeah, exactly.
Think about it. In whether it is in medicine or in anything you do, the joy when you have a little extra money, a little extra time, a little extra, the joy that you get from using it for yourself is a lot less. It's a fraction of the joy that you get by giving it to someone else.
Yes. Yes.
And I get to do this in my, so I'm like a ball player. I mean, I get paid for doing that every day.
Yes, exactly. Exactly. What is the future of how you see the advances in your field? What do you see? Do you see some great advances before I let you go here tonight? Do you see some great advances?
Absolutely. So there have been few advances in medicine which were literally like the discovery of phone example in the technology, right? So what are the great advances in medicine? So last century, in the 19th century was discovery of anesthesia, and suddenly you could do the surgeries. Then in the 40s, we discovered penicillin, and suddenly pneumonia stopped being a deadly disease, right? So now we are at the cusp of that monumental changes, and that is genetic engineering. So genetics, CRISPR is another specialized genetics technique. The medications which are coming out with genetics, they are transforming the cardiovascular disease. We now have a cholesterol injection that you take only once every 6 months, for example. We are also coming out with a CRISPR-based cholesterol injection that will change your cholesterol gene so you don't even have to take the medicine. So next 10 to 15 years are going to be incredibly interesting because of all these discoveries in genetic engineering, and the drugs, they are directly derived from those technologies.
Wow. I don't know how to thank you for this tonight. This was fantastic. I want to leave our audience with this. In 2009, I was diagnosed with atrial fibrillation, and I met Dr. Parag Doshi. Everything he has told you here tonight is the utmost truth. A gentleman who guided me back to, I was coming off a very stressful time in my life with working and coaching hockey and everything else. And I'll never forget the first words he said to me when I says, Dr. Doshi, I'm fine. And he looked at me and he says, Mr. Conenna, you are on a downward spiral and we need to take care of you. Right then and there, the light switch went on for me, Dr. Doshi, that I knew I was in great hands, because he works with his patients to develop disease prevention strategies using lifestyle, diet, and changes. I'm going to say this to you, Dr. Parag Doshi. You are true when you say, off your slogan of Chicago Cardiology Institute, every heartbeat is precious. Dr. Doshi, please keep doing what you're doing, because without you, I don't know where I would have been, and I don't know where all your patients would have been. This was fantastic, and I was truly honored tonight.
Oh, it has been an honor, and I have to add 30 seconds of the media.
Yes, go ahead.
You picked up the slogan of Chicago Cardiology Institute, my every heartbeat is precious, right? That was not my quote. Our logo, the two hands holding up a heart, as well as that, comes from a very appreciative husband of a 30-year-old patient of mine who was almost going to die in an actually center for heart transplant. And so he came up with that.
That just, and you know what? It's that is how I think of you every day. And this was fantastic for anyone who's going to see this interview. I truly recommend Dr. Parag Doshi. And Dr. Doshi, thank you for this evening.
Oh, John, it's been a pleasure. Thank you. And it's my privilege to be your doctor and your friend.
Oh, mine too. You're from the bottom of my heart. I thank you.
Take care.
Good night, everyone.
Good night.